SOOLANTRA Cream is used to treat a certain skin condition called rosacea, a type of adult acne. The active ingredient in SOOLANTRA Cream is ivermectin. Ivermectin may help to decrease symptoms caused by rosacea, such as redness, swelling, and pimples. How to use. Always use this medicine exactly as your doctor has told you. Check with your doctor or pharmacist if you are not sure. SOOLANTRA is intended for adults and only for use on the skin of the face. Do not use this medicine on other parts of your body, especially not moist body surfaces, e.g. your eyes, your mouth, or any mucosa. Do not swallow. The recommended dose is 1 application on facial skin per day. Apply precise amount of the cream to each of the 5 areas of the face: forehead, chin, nose, and each cheek. Then spread the cream as a thin layer across the entire face. Make sure to avoid the eyelids, lips, and any mucosa, such as inside the nose, the mouth, and the eyes. If you accidentally get cream in the eyes or near the eyes, eyelids, lips, mouth, or mucosa, wash the area immediately with plenty of water. Do not apply cosmetics such as other facial creams or makeup before the daily application of SOOLANTRA. These products can be used after the applied cream has dried. Wash your hands immediately after applying the cream. You should use SOOLANTRA daily over the treatment course, and the treatment course may be repeated. Your doctor will tell you how long you will need to use SOOLANTRA. The duration of treatment can vary from person to person and depends on the severity of the skin disorder. You may notice any improvement after 4 weeks of treatment. In case of no improvement after 3 months, you should discontinue SOOLANTRA and consult a doctor. Contraindications. Don't use SOOLANTRA if you have an allergy to any medicine containing ivermectin. If you have an allergy to any of the ingredients. For any children under 18 years of age, some of the symptoms of an allergic reaction may include shortness of breath, wheezing or difficulty breathing, swelling of the face, lips, tongue, or other parts of the body, rash, itching, or hives of the skin. Warnings. At the start of treatment, some patients may experience worsening of the symptoms of rosacea. However, this is uncommon and usually resolves within 1 week of treatment. Talk to a doctor if this happens. If you become pregnant, contact a doctor. You will need to discuss the benefits and risks of using this medicine while you are pregnant. It is not known if this medicine is found in breast milk after topical use. Don't breastfeed while using this medicine. Before using ivermectin cream, tell a doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Side effects. All medicines may have some unwanted side effects. Sometimes they are serious, but most of the time they are not. Your doctor has weighed the risk of using this medicine against the benefits they expect it will have for you. Do not be alarmed by this list of possible side effects. You may not experience any of them. Tell your doctor if you notice any of the following and they worry you: skin burning sensation, skin irritation, itching of the skin, dry skin, redness, rosacea aggravation, swelling of the face. These are mild side effects of the medicine and are usually mild and short-lived. If any of the following happens, stop using SOOLANTRA and tell a doctor immediately, or go to accident and emergency at your nearest hospital. Shortness of breath, wheezing or difficulty breathing, swelling of the face, lips, tongue, or other parts of the body, rash, itching, or hives of the skin, liver enzyme elevations. These are very serious side effects. If you have them, you may have had a serious allergic reaction to SOOLANTRA. You may need urgent medical attention or hospitalization. Serious side effects are very rare.